My name is Leslie Pitts, and I'm a pediatric nurse practitioner and the first graduate of the dual DNP-PhD program at UAB School of Nursing. I came to UAB in 2002, so it's been a long time ago now since that first time, and went through the School of Nursing as a BSN graduate in 2006. After graduating with my BSN, I worked at Children's in the Pediatric Intensive Care Unit as a nurse for about 5 years. And so in 2007, I enrolled at UAB again in their Pediatric Nurse Practitioner program and graduated in 2009 and went to work at Children's in Birmingham in the endocrinology clinic. But little did I know when I started that career, I would work on a grant that was funded through the Alabama Department of Public Health for the state's newborn screening program. And so through that work, I became really familiar with a rare congenital condition called congenital adrenal hyperplasia. And so as we were the only referral center in the state for all of those kids, they would come to see me in clinic, and I got to know those families really well. And what we found, though, in clinical practice was that they would do really well in the pediatric years, and then as they got into their adolescence and started to take on more of the responsibility for their condition, sometimes their control would sort of slack off and they would be more vulnerable to adrenal crises and hospitalizations and even death. And that really became sort of the focus of what I came through this program to do. I knew that I wanted to get the DNP. I knew that I wanted to pursue the PhD. I knew I had clinical questions that were informed from my practice. And so I had a passion for that. Seeing how it would all come out in the end was a little bit unclear for a while, but I think you can see how the question has informed the work and the work has informed more work, and so now it's just kind of exciting to see where this is going and how the education is really impacting practice. For me, being a nurse always comes down to meeting somebody where they are and kind of slowly guiding them in the way towards health. You know, I think that doesn't change as you become a nurse practitioner or as you become a nurse scientist. I mean, you still are meeting people where they are. And I think that's one reason why I'm so drawn to the type of research that I enjoy, which is, you know, very pragmatic, very like, this is the way it is in practice, because that is how we're going to actually make change in outcomes, is meeting people where they are.